Hey, Future Medics, it's me, Tina, your medic mentor, and today we're talking about a medication that's not as popular anymore, but still really important to know. It's dopamine. Now, dopamine doesn't have a brand generic name for you to remember, it's just the one, which makes it so much easier, which is great because the rest of this card is pretty complicated. So let's see if we can break it down, okay? So dopamine is a sympathomimetic, which we saw with Epi 1 to 10 recently, but it's also a vasopressor. So it works differently depending on the dose that you use, which is interesting and we haven't seen yet. Because of that, this is called a dose-dependent medication. Whenever we look at the low doses of dopamine at about 2 to 5 mics per kg per minute, that's how it's dosed, by the way. It's always weight-based. And you'll see it in micrograms per kilogram per minute, okay? So at the low dose of 2 to 5 mics per kg, you're going to see it work on dopaminergic receptors, which increases kidney perfusion, which is great, I'm sure, but in EMS, we don't do anything with that because I have no way on the truck of checking anyone's kidney function. So there's nothing I'm going to be able to do with this. But that is what the low doses do. So let's look more at the moderate dose. So the moderate is going to be, it's 5 to 10 mics per kg per minute. And the moderate dose here actually works on those beta 1 in your heart receptors. And it will increase that heart rate and increase the contractility and the hard pump of the heart, which is great for our bradycardic patients or our cardiogenic shock patients. Now let's look at the high dose. These high doses, which is going to be 10 to 20 mics per kg per minute, we're going to see it work more on the alpha receptors. So we're going to see more vasoconstriction, which is going to increase blood pressure, which is wonderful for our hypotensive patients. So that's what the 3 different tiers of this medication do. So at different levels, it works differently. This is going to be a continuous IV infusion. We don't push it. So you're going to need an IV or an IO. Its onset is about 5 minutes, and it lasts 10 to 15 minutes. So to keep a close eye on your patient, you're going to need to take their blood pressure a lot more often. And we titrate this medication to effect, depending on our patient's blood pressure. Now, you will see this either already mixed or need to be mixed, and it will come as 400 milligrams. I know I said micrograms, stay with me. 400 milligrams in 250 milliliters of D5W, which we've talked about before. That math works out to 1,600 micrograms per milliliter. Now, usually your IV pump is going to take care of that, but National Registry loves to ask about it. Side effects to look for are tachycardia, hypertension, chest pain, and arrhythmias. The contraindications, you're going to do known adrenal tumors and known tachydysrhythmias. But also, it's really important to know this is not good for patients with hypovolemia. If they have lost a lot of their fluid, we need to replace that fluid because us causing major vasoconstriction and squeezing down on the fluid that's barely there, it's just really not going to make a difference and it's not going to help. So if we refill the tank and then actually have something to squeeze on, it'll work. An important thing to know about this one is infiltration of the line can cause necrosis. Just like we talked about with dextrose, it will eat away at tissue. So make sure you have a very patent line, that things are flowing well, and there's no bubbling up right at the end of the catheter. Those would be signs that this is not a good line. Stop the medication immediately, start a new line. So much so in the hospital, they like central lines for this one. Obviously, we can't do that in the back of the box. It's not sterile at all. So we do what we can. Just keep a really close eye on that line. Okay? But here's your takeaway. Dopamine is a dose-dependent medication that will help with hypotensive patients and cardiac output in your sick patients. It's not really on the front line anymore, but you are going to see it in old protocols or interfacility transfers. So it is so important that you know how to manage this medication safely. But that's it. Seriously, this was a hard card. So if you made it through this and you understand, you're doing a great job. I'll see you for the next one.